Welcome to Logical Ayurveda. Last video, we understood about Varanadi kashayam in detail and indications and contraindications about it. And this video is just an extension of last video for helping to understand Varanadi kashayam. So, to understand the indications of Varanadi kashayam better, we should only keep in mind about two things. Wherever there is growth in the body and wherever there is obstruction in the body, one should use Varanadi kashayam, provided the patient is fit for it. How do you decide whether the patient is fit for it? The four golden questions that you need to ask before prescribing Varanadi kashayam that I mentioned in the earlier video. The four golden questions, that is gastritis, whether the patient has gastritis, whether the patient has fissure or bleeding, the patient has repeated UTI, or the patient has white discharge. You should be very careful in prescribing Varanadi, or it is better to not to prescribe Varanadi depending upon the condition and the patient involved. So wherever there is growth and wherever there is obstruction, definitely Varanadi kashaya should be prescribed. And when I mean growth and obstruction, what kind of growth and obstruction? First, growth. Wherever there is growth, you prescribe Varanadi kashayam. The good example of growth is nasal polyp. In nasal polyp, you can prescribe Varanadi kashayam and Kanchanara guglu to reduce the size of the polyp. And in excessive fat accumulation, obesity, hypercholesteremia, etc., definitely fatty liver, accumulation of fat in the liver, in all this condition, wherever there is fat growth, definitely you can prescribe Varanadi kashayam and Kanchanara guglu, provided the tick list is good. And another type of growth is polycystic ovarian disease. In polycystic ovarian disease also, as I told, Varanadi kashayam along with Kanchanara guglu is very beautiful in treating polycystic ovarian disease. Sometimes I mix Varanadi with Saptasaram, sometimes I use Saptasaram kashayam alone when the periods are irregular, and I also make sure whenever for this growth, wherever possible, I also include Shiva Gulika, because that is also useful in treating the PCOD and other conditions, other growth conditions as well. Wherever there is polyp or some mass inside, definitely Shiva Gulika also will help along with Varanadi kashayam and Kanchanara guglu. So even in hypothyroidism, now whether in hypothyroidism or goiter, swollen thyroid glands, whether all patients we can give Varanadi? No, definitely all patients we cannot give Varanadi. Wherever there is Kaphavada involved, wherever there is Medo Dhatu involved, definitely we can go for Varanadi. And you should also keep in mind the climate of the desha where you are giving. You cannot go on prescribing Varanadi kashayam along with the Kanchanara guglu for 6 months in Chennai or Rajasthan based climate, because it definitely at some point of time Pitta is going to get aggravated. So you should always see Desha Kala and Dosha Dusha and accordingly treat the patient. So in hypothyroidism, definitely Varanadi is good, but when Pitta is involved, it's better to go for Punarnavadi and Gokshara guglu or Punarnava guglu, etc. But if Kaphavata is involved, definitely Varanadi kashayam, Kanchanara guglu, I find it very useful. And in fibroadenoma of the breast, definitely you can use Varanadi. So wherever there is growth in the body, you can use Varanadi, provided the patient does not have Pitta symptoms. Or even if the patient has Pitta symptoms, you can prescribe the medicine or adjust the medicine in such a way that Varanadi does not give any bad effect to that body. How to adjust the medicine, I will tell that particular thing in the last part of this video. And wherever there is obstruction, wherever there is normal flow of dosha dhatu, wherever there is normal physiological flow, something that is obstructing that physiological flow, you can definitely prescribe Varanadi kashayam. Good example of Varanadi kashayam is gallbladder stones. I make sure I treat gallbladder stone less than 0.8 centimeter, 8 millimeter, and there are no multiple stones, there are no excessive sludge, then only I prescribe medicine for gallbladder stone. If the stone is more than 1 centimeter, I don't touch the stone. If the stone is stones are multiple and the patient has severe symptoms of cholelithiasis, fever, an active symptom, etc., I prescribe surgery. Whenever the patient stone is less than 8 mm, and then only I go with different kashayas like Varanadi kashayam, Patola Katruinedi kashayam, Vilvadi Gulika, Kanchanara guglu, etc. Such kind of medicines I give it to the patients, and I have found good results out of it. I have had my successes and I have also had my failures as well. So it's not a steadfast rule that somebody comes with 0.8 centimeter of gallstone, you're going to give Varanadi kashayam, definitely you're not going to have results. And it depends on a lot of other factors as well that we will discuss in some other video. And kidney stones, wherever there is Kaphaja Ashmari involved, wherever the stone is rock solid, definitely Ashmari is a Kaphaja Roga. Ashmari happens because you eat a lot of meat or a lot of oil fried foods and you don't move a sedentary lifestyle, you don't drink enough of water to flush out the excess of protein or fat you have taken, then only kidney stone happens, Kaphaja Ashmari. In that Kaphaja Ashmari, provided there is no Pitta symptoms, provided there is no burning sensation, urination or blood in urine, etc., can definitely use Varanadi kashayam and Kanchanara guglu to break that stone and get it out in a shorter time. You can also use Pashana Bedi along with it, Hajruli Ahud Basma, etc. These all things are useful along with Varanadi kashayam. And sinusitis, as I mentioned in the last video, the sinus is something that is obstructing the normal flow of phlegm. So sinusitis happens, the patient have obstruction of nose, heaviness in the head, etc. And that particular stuff where there is kapha involved, Varanadi excellently relieves the kapha and gives the clarity, clearness to the channels, and help in improving the help in removing the phlegm that is present in the sinus. So there in Kaphaja Shirashula, it is definitely very much helpful in Varanadi kashayam and Kansara Guglu. The crux of the matter is wherever there is growth and obstruction involved, definitely you can go for Varanadi kashayam provided there are no pitta symptoms in the patient. So how to manage even with the patients having pitta symptoms? Then also you can manage by giving Varanadi kashayam. For example, what is a maximum that Varanadi is going to do? Varanadi is basically Ushna Ruksha. It can cause constipation. So whenever you prescribe Varanadi kashayam, you can co-prescribe. If you have doubt that the patient is going to get constipation, you can co-prescribe Brihat Triphala Churnam, Trivrit Lehyam, Anuloma Churnam, etc. And that particular problem is solved. And when the patient is having burning sensation or gastritis, etc., I make sure I do not prescribe Varanadi. Or you can mix it with Varanadi kashayam plus Bella Gulichadi kashayam, or Varanadi plus Gulichadi, or Varanadi kashayam along with Acidact or some Ulcerex tablet or some anti-ulcer tablet you can give along with it. That can neutralize it, but if the patient is extreme pitta and have active burning sensation, make sure you don't prescribe Varanadi kashaya at all. So if the patient has UTI, you can co-prescribe Varanadi kashayam with Punarnavadi kashayam, with Kamaduga along with Mukta, and with Narikela Asava, etc. Something which can reduce the pitta, you can prescribe along with it. So constipation, burning sensation, and urinary tract infection, you can find the proper medicine for that, and you can co-prescribe. If at all, you have to definitely use Varanadi kashayam and Kanchanara Guglu.